Good evening. I want to welcome everyone to our first COVID-19 update here for the city of Brockton, as well as for the county of Plymouth. Today is Wednesday, May 13th, 2020, and I'm Plymouth County District Attorney Tim Cruz. And joining me tonight on this COVID-19 update is Mayor Robert Sullivan from the city of Brockton. Mayor, thanks for coming on board.
Thank you, Mr. District Attorney. How are you? Thank you for having me on.
Very good. And also we have Plymouth County Sheriff Joe McDonald. Sheriff, thanks so much for also coming on.
My pleasure to be here. Thanks for having me.
Well, myself and the sheriff and other elected representatives have been going on various cable shows in towns throughout the county, just giving updates as to what's going on with the district attorney's office, what's going on with the sheriff's department from our perspective. And I'm very glad that Mayor Sullivan is here tonight to give us an update as to what's exactly going on here in the city, because obviously, Mayor, you weren't mayor very long when this incredibly challenging and unprecedented time has come and really challenged all of us. And I commend you for, I know, what you've done so far and what you continue to do and the work and the effort that you and the city are putting here for everyone that lives here in the city of Brockton. So maybe we could just start with that right now. You've been dealing with this situation like we all have for the last couple of months, and where you currently are right now and where you see this going.
Yeah, I know. I want to thank you and the sheriff for what you do for the county and the community that I represent here in the city of Brockton. And you know, you're both very, very dedicated public servants, and I want to thank you both. So right now, current cases here in the city of Brockton, we've lost 205 Brockton residents, 205 loss of life, and our thoughts and prayers go out to the departed and of course their surviving loved ones. Current active cases, we have 2,264 residents dealing with positive COVID cases, and total cases overall here in the city of Brockton, 3,426. So I do want to thank publicly Governor Baker and Lieutenant Governor Polito, who have helped us out. As both of you know, we're a hotspot here in the city of Brockton when you look at the Commonwealth, and the numbers speak for themselves. But some of the things that I've done as mayor, I actually have created wonderful relationships. It's a collaborative approach with the fact that we have the VA hospital here, we have Signature Brockton Hospital here, we have Good Samaritan Medical Center, and of course, Brockton Neighborhood Health Center. So increased testing capability has been a godsend. We have started a week ago testing at Brockton High School at 470 Forest Avenue. And it's a collaboration between the Neighborhood Health Center and also Signature Brockton Hospital. And just today, we tested 180 folks. And the criteria for the testing, Mr. DA and Sheriff, is that if you're any essential worker, not just from Brockton, but any essential worker, anybody that has been exposed or anybody that has symptoms of COVID-19. One thing that I'm really proud of is the fact that I've hired a medical doctor, an MD consultant for the pandemic, Dr. Rick Herman. I'm sure you guys know Dr. Herman. He used to be chief of ER at Brockton and also chief of ER at Good Sam. So the fact that NEMA and DPH are working with the city of Brockton very diligently to help people facing homelessness with tents at Perkins Park to spread the population there has been a game changer. But ultimately, it's getting the message out and adhering to the social distancing parameters of 6 feet and wearing masks. So it's a daunting task. A loss of life is great. It's been tragic. But I am proud of the fact that Brockton as a community is coming together to try to weather this nasty virus.
Well, that's great. Is there a way, if a non-essential worker wants to get tested at the area you're talking about, is there a pre-registration or an appointment that's necessary to go up there? Is that how it all works?
There is. You have to call a hotline. You also have to just be pre-screened. You can't just show up. You have to pre-screen again. You could call 508-580-7123. That's the mayor's line here. We're here every day, even though City Hall is closed to the general public. My office is here. My team's here. And again, it's 2 tents up at Brockton High. You're coming from the Forest Ave entrance past Marciano Stadium. One tent is dedicated to the Neighborhood Health Center patients. The other one is to Brockton Hospital patients. And then you could just exit from the Belmont Street entrance of Brockton High that way. So between that and Quest giving us a multiple of testing capabilities, it really has been a win-win. And ultimately, the other thing that's extremely important, and you guys know about this as well, is the contact tracing services. So the city of Brockton only has one health nurse, Evelyn LeBron, who works for the Board of Health. And we were able to get 8 different public school nurses on loan from Mike Thomas in the BEA. Mike Thomas, again, is the superintendent of schools for Brockton Public Schools. So we only had 9 people doing the contact tracing services. So Lieutenant Governor Polito had reached out to me as well as Congressman Lynch saying, what else can we do to help Brockton? You're greatly impacted. And Partisan Health has been a godsend as well because it's contact tracing services. And it's exactly what it says. They're tracing any type of contact. If you were exposed or potentially exposed within 48 hours, they will contact you. The caller ID that will show up on your phone, it's a legitimate caller ID. It says MA for Mass COVID Team, Mass COVID Team. If you see that, that is a legitimate call. And they're trying to do a tracing to inform people of potential exposure so you can quarantine and then self-assess and self-monitor for any symptoms. So the state has really been a great partner as we move forward here in the city of Brockton.
That's great to hear. And also, as we go around and talk about a lot of things happening in our county, one of the issues that we've been dealing with, unfortunately, is a lot of the individuals who are trying to take advantage of this situation, people who are going online and calling you up and trying to talk you into things. And I've been telling people that if you get a call that says COVID-19 on your caller ID, pick that phone up and talk to those people. And remember, you'll know it's a scam if they start asking you for information like your credit card number or your social security number or your PIN number. The true COVID people are not asking for that information. They're trying to get the prerequisites that they need in order to get the information they need to figure out about the tracing. So people should just be, as always, be very vigilant with their information so they don't give that out. And I know that the sheriff's been going around talking about some of the scams that have been happening in our county also. I was wondering if you had any information regarding for that, Sheriff.
Yeah, certainly, Tim. I know with the advent of this COVID virus, there has been a lot of scammers out there that are playing off this, over the phone, through emails, those junk emails that you get. They're really something. And, we knew this was going to happen. And it's important that people are vigilant, especially on those phone call ones. And it's interesting. I don't know. I was driving to work last week, and as I was driving, I listen oftentimes to WATD radio, and I hear my father's voice, and I didn't know that he was going on. I don't know if you heard him, but he apparently received one of the scam calls, but one of the old formula scam calls, whereby they call up and they say that someone has been in a car accident, they've been arrested. And, luckily for him, he didn't have the money they were looking for, but he said they were very, very convincing. So he went on the radio to tell people. So I think the important thing to know is that be very, very careful. As you say, the scammers are identifiable because they're asking you for personal identifying information, credit card numbers, those types of things. There is no legitimate reason that anybody doing the contact tracing needs any of that. For identification purposes, they called you, they should know who you are. Leave it at that. And if they're going to play those games, you hang up the phone. But the other thing I think that's important for us to remember is that the old scams are still out there working as well. I think they believe, and hopefully wrongfully so, that with all this going on, our guard is going to be down, that we are going to be perhaps more vulnerable to the pitches that they're making. So be very vigilant, be very, very careful. And if it doesn't sound right, chances are it isn't.
Well, as you know, Sheriff and Mayor, we have senior luncheons every year. We always talk to the seniors in our community, in our county. And it always goes back to, when we were growing up and what our parents would tell us, that if something sounds too good to be true, it is. And unfortunately, what we've seen in our county, some of the scams going for seniors are kind of a morphing of regular scam, like your grandson's being held in custody in another state, and we can't get him to court because of COVID-19 for a week unless you come up with X amount of dollars. And unfortunately, it's actually worked in a couple of towns right here in our very county. So I think the more we can get the word out to everybody, whether we're here in the city or whether in some of the other adjoining communities, let them understand that people are out there and they are trying to take advantage. It's not unusual, unfortunately, the people that try to, I remember after 9/11, there was a lot of the scammers going on then. And right now we're dealing with the same issues. So everybody, please just be vigilant. So that's a good point. I thank you for that. And Mr. Mayor, I know also here in the city, you're doing a lot of different things from having a curfew, from having various things that are going on regarding payment of bills, or anything you want to tell the constituents here in the city of Brockton as to how you feel all those are working right now, the curfew and the pay, even just mundane things, because as you said, City Hall is closed. So where do people go? How do they go about paying their bills if they wanted to?
Yeah, no, thank you very much. So again, I've taken certain mechanisms that are allowed locally, declaring a local emergency, working diligently with the curfew. It's a mandatory curfew from 9 p.m. to 6 a.m. And now with the governor's mandate of mandatory masks, I have Brockton police cruisers driving around. We gave out 5,000 masks, working to just get the message out. Of course, Brockton's such a beautiful, diverse community. That's what makes Brockton so special. So out of abundance of caution, I've done certain things. Some people have criticized it, but again, we're just trying to save lives. And we know at the end of the day that this virus spreads when people come in direct contact in large groups. It is frustrating, I'll be quite honestly, when I have to call Brockton police to Edgar's Playground, like yesterday, where there was 20 kids skateboarding. Also recently got a handwritten note from a youngster saying, "Why did you close the parks? Why are you having a curfew, Mr. Mayor? Because only old people get COVID, only old people die from COVID." There's just such a misunderstanding of that virus. So, out of really an action as mayor, I needed to do that. My wife is medically trained. She's a PA. She went to medical school. She had known this was coming up when it was still in China and Italy. So I did take office on January 6th, and we rapidly jumped upon this with having different entities sit around a table to brainstorm. 3 times a week, I have calls with all the hospitals, twice a week with all the nursing homes, once a week with all the banks and unions and the like. And it's just sharing ideas, best practices. In terms of financial endeavors, we know businesses and a lot of moms and pops, and some have been here for generations, are truly hurting right now. So again, the real estate tax was pushed off, excise tax was pushed off. I waived all late fees. I waived all convenience fees if you pay those online. Pushed off just recently the water, sewer, utility bill. Little things that I can do that are making a difference. I'm on a call 4 times a week with regional mayors. There's 19 mayors led by Mayor Walsh, and Governor Baker's been on the last 2 calls. We had one today with Senator Spilker, Senate President, Friday night with the House Speaker, Mr. DeLeo. And, the magic May 18th date is just a date. And what I keep saying to people is, we have to have data specific, not date specific. And our data shows right now in terms of Brockton in the City of Champions, we're still in the middle of this. We're in the woods. So different things that I can do to help. But if anybody that's listening to the show or watching the show has any questions at all, City Hall's closed to the general public. We are ready, willing, and able to help. We're working with our department heads. And again, the 508-580-7123 number is key.
That's great. Sheriff, you certainly have had your hands full down at the jail. And I was wondering if maybe you could give the people here in Brockton an update as to what exactly it is, how you down the jail, how you're fighting the coronavirus down there regarding people coming into your institution or staying at your institution, or even people that are being released back into the world once they leave your institution. Perhaps you give us an update on that.
Certainly, Tim. I know a lot of people are hearing a lot of very, quite frankly, scary reports in the news that in correctional facilities nationwide, how the virus is running rampant, much like in the nursing home settings. But the good news is here in Massachusetts in general, and in Plymouth County, speaking for our own correctional facility here, we have been, I want to say that we've been very lucky. We've been blessed. We have had, up to this point in time, only a single inmate testing positive for the COVID virus. And we saw this coming, like Mayor Sullivan, we knew that something was going to come of this. And, the old saying, what goes around comes around. I think that applies to this type of a situation. So we started to brainstorm. We haven't seen anything like this in 100 years, since the Spanish flu of 1918. So we started with an empty playbook, really, is what it was. So we are having to create policies and procedures to keep our inmates and our staff safe during this type of a situation. So we started to that end, all the sheriffs banded together, all 14 of us, We've cut back to 3 conference calls a week, but we were doing conference calls 5 days a week when this first began, sharing with each other the ideas, the policies and procedures that we had all put into place. So what we've done down here in Plymouth, and we've done it in all the correctional facilities here, physically, we were very lucky because there's really only one driveway in and out of the correctional facility. So what we've done is we have manned the guard shack there, and we have medical officers there, as well as some corrections officers who will be there to greet people as they come, lawyers, actually even all employees. I am screened as I come in. They'll ask you a series of questions. You know, some of them you know the answer to when they see me or some of the other officers. Have you been out of the country? Have you done certain social things? Have you interacted with anybody who've been exposed to people with the virus? Those types of questions. And they will also take your temperature. And we've got these machines now that allow them basically to hold, they don't have to touch you with it, but they will take your temperature from a distance and get an accurate read. And anybody who answers any of those questions in the affirmative is turned around and sent away. And anybody that is going to have a fever, whether they're employees, luckily I haven't had a fever yet, so I've been able to come in every day. So we're stopping those types of things at the gate there. But the interesting thing, and what worried me from the beginning of this whole thing, was the steady flow of people that come in to the correctional facility from the courts, from the outside, even our employees as they go home to their families. They're out in the community shopping at the grocery store, going to the post office, and possibly being exposed and coming in. So outside is where this virus will come to the facility. But for individuals who are coming to us, inmates, incarcerated folks who are coming from the court or coming from one of the police departments, we have instituted a situation whereby, you know, obviously we screen them as well, same as we do the employees and the visitors. We also would then put them into a situation where they're quarantined, isolated, if you will, for a period of days, during which we monitor them for symptoms. And those that are symptomatic are tested. And we have had 19 inmates so far that have either complained of symptoms, described symptoms to us, or we have observed symptoms. And all have been tested, you know, in accordance with the DPH guidelines, CDC guidelines. We're testing people that we have a reason to test. And one of those, only one has come back positive. So we've engaged also in, you know, the PPE that we hear so much about now, the personal protective equipment, masks, gowns. Those things are much more available to us now than they were. The sheriffs have been working with MEMA, the Mass Emergency Management, and we have gotten sufficient supplies of those, not just for staff people, but for our inmates as well. Everyone is social distancing. We've engaged in a very heavy education program to explain to our inmate population as well as staff the importance of hygiene, to wash those hands, to socially distance. We've made a lot of changes inside the facility, and I am pleased to report that with only, you know, one inmate, we've been highly successful. I will state there have been 6 staff people who have tested positive, and you know, the good news on all of these things is our inmate has recovered and he's doing well. 6 staff people. We had 3 people that work full-time inside the jail, 2 caseworkers and 1 correctional officer. One of the caseworkers is cleared to return to work. The other 2 are recovering at home very well. We had 3 outside people. We had 1 communication officer who had tested positive, 1 officer in our civil process division, and 1 of the reserve deputies who has been working out in the community. He tested positive. All 3 of those individuals are self-quarantining, treating themselves at home and doing quite well. So we have been very, very lucky. And when I say that, I want to say, you know, that luck translates or comes from 2 sources, I think. One of those is, you know, as my grandfather said, the harder we work, the luckier we get. The hard work of the men and women down here at the Sheriff's Department, they have done a phenomenal job. And I have to attribute some of this to the grace of God. We have been very, very lucky.
Well, you know, I appreciate that. And I think you should take a lot of the credit too, Joe, because I understand how difficult it is. And to hear you both talk, I think people should understand that, you know, we're all in positions where we're trying to do as best as we can with the information that we have. And I think it's great that you're talking to all the sheriffs. You know, Mayor Sullivan's talking to other mayors and talking to state government. I'm talking to the state DAs and national DAs where I'm on the board of directors of national DAs. We're all, because this is such an unusual situation and we don't pretend to have all the answers, but we do know enough to facilitate meetings and share information to get best practices. And that's why working with the state government, working with the local officials, I think that just makes all the difference. And I think also a lot of the things going on down at the jail right now, first and foremost, I mean, a lot of the horror stories that are out there of everyone being crammed together, down at least in your facility, I just know that's not true because the numbers are down so low. There's this myth out there of individuals who are being incarcerated via mass, and that's just not true. I mean, what are your numbers now?
Yeah, thank you, Timmy, for bringing that up. I neglected to mention that in my previous comments, but you're right. The design build of the correctional facility down here is 1,250 people. The numbers in the past have been as high as 1,700. But as we sit here today, our daily census count over here is somewhere about 650 people. And as you can imagine, you know, we're about half capacity. And, you know, we've done a lot of things that have really allowed social distancing. I know a lot of folks are worried about the people that are in the correctional facility, but I have to say, and I think, you know, when you think about it, you'll agree that many of the folks that are with us have access to the medical care, the food service that we have. We have to be so careful when we release people into the community. As you know, we start planning for their reentry into the community really as they're coming in the front door. You know, the programs that we have in place. And one thing that people don't necessarily think about is when you release people from the correctional facility without a plan, some of these folks, actually many of these folks, don't have any place to go. They may not be welcome to go home to the family that they left. It can really cause turmoil in a person's life. And if they don't have a plan, you can almost guarantee that they're not going to be successful back in the community. So we're very mindful of that. I do know, and I want to thank you and your staff for assisting, you know, in the courts. Things have calmed down a little bit, but, you know, all those motions that were being brought to have bails reduced, individuals released, you know, we've done that thanks to you guys in a very thoughtful and careful way that I think has maintained and preserved public safety. And I guess the big message that I want people to understand is the folks that we have here in the jail are very safe. And I'm just not referring to the inmate population. I mean, our staff as well. They've done an excellent job and everyone has really, really done an outstanding job. I couldn't be more proud of the folks here.
Well, no, I think that's great, and I'm appreciative of the work that you guys are doing down there. I know the whole reentry programs, and Mr. Mayor, sometimes I'm not sure if you're aware, but sometimes myself and the sheriff will work to the mayor's office over the last few years having job reentry fairs for individuals from down the jail. They've been incredibly successful. We usually have them at the War Memorial Building and really giving people opportunities at really good jobs. And so I'm always thankful of people that we know, the people that are going down with the sheriff. 98% or so are going to come back out in the real world at some point. So let's help the people that we can and help them re-enter. And now with the challenges that we're facing, and I can just talk a little bit about the DA's office right now, which is also, I've been the DA now, I'm in my 19th year, and we've certainly never faced a circumstance that we've faced the last month and a half. The court system right now is closed until June 1. And like the mayor said, that's really not a hard and fast date. That's the date that we have, that we believe things will get up and running. I believe it'll be like, I think probably May 18th is going to be kind of a slow rollout for things and just baby steps. And that's probably the smart way to go at this point. But the cases that we have, when the case gets up and running, if people have any questions regarding their cases, regarding if they're a victim, if they're a witness in a case, please call the DA's office at 508-584-8120. That's 508-584-8120, or go onto our website, PlymouthDA.com. We have all sorts of information there throughout our entire county of all the challenges that we face, because even though the Mayor's Institute of Curfews and the police are doing a tremendous job, the firefighters, the first responders, they're really doing a remarkable job. And what we see, not just in Brockton, but throughout the county, is that our number of arraignments, so people are actually being arrested, is way down. I think countywide in the last few weeks, we've only had 109 arraignments. Normally, we would have that easily in a week. And that's for all 4 of our district courts, Plymouth, Brockton, Wareham, and Hingham. So when you're talking those different courts and you're talking individuals now who are trying to get released as a result of COVID-19, we're also trying to make our decisions based upon what's in public safety's interest. What's the best thing that can happen for, like the sheriff just mentioned about a release plan is really important. Having a place to go, having medical help, having food, an opportunity to see a doctor if you're ill, and not overloading some of the homeless shelters that are out there where individuals coming down there. Right now, I know that the homeless shelters need our help. They need to make sure that we can help them to the extent that we can. If there's an opportunity for you to give blood right now, I know there's a real need for blood. We need to make sure that we do that. Myself and the sheriff were going to do a blood drive a couple of weeks ago, but unfortunately it was canceled. We're going to try to redo that again, because it's not like the old blood drives where, we used to have a van pull up here in front of the DA's office and we'd have appointments and people would come in. But because of COVID-19, it's not the same thing. We're trying to make sure we have appointments, keep social distance, making sure that we can do all the various things that we can do. But, some of the things that are also going on right now, and like I said, I commend everyone because these are difficult times and none of us have really faced them before. By sharing information and talking to each other, I think it makes a huge difference. And that's why I think we try to do forums like this, just talking about what we're doing here and what the rationale is behind that. I think it's important for people to hear that. But also I know that, we're dealing with other cases and problems that are out there right now. And problems that we're all dealing with, from the mayor's office, from the sheriff's department, from the DA's office. We continue to deal with the opioid crisis, which is ongoing in the middle of all this. We just had a fatal opioid overdose 2 days ago in the city of Brockton. And, how do we continue to make sure we can get help for the people that need the help? Because when you are in the throes of those addictions, there really is, the pandemic is not going to get in the way of your need, your physical need, your physical craving to get these drugs, this poison really that's out there, whether it be heroin or a version of opiates, or whether it be fentanyl or carfentanil, or whatever the mixture may be. I know that the police and the fire are still administering Narcan. They're trying to minimize the people who we bring into the system, and also trying to minimize some of the situations that we're doing regarding some of the other cases that we have. Unfortunately, I know school is closed, Mayor, until right now. I'm sure it's closed for the rest of the year. But one of the things that we try to talk about right now is, even though schools are closed, school teachers do a remarkable job, and they have an incredible challenging position. And quite honestly, they're some of the most important mandated reporters that we have regarding kids who might be endangered, whether they're endangered by drugs or whether they're endangered their safety and their neglect. I'm looking at our numbers now, and as many people know, here in Plymouth County, we have the Children's Advocacy Center, the main buildings right on Pleasant Street here in Brockton. I'm looking at our numbers regarding child abuse, regarding the cases that are referred to us. And in the time period between March 16th through May 1, a year ago, we had roughly 160 mandated reporters, and a mandated reporter is a report of abuse and neglect for a child. Fast forward this year, during the COVID-19, we're down almost to a third of that, 60 cases. Now, that's not because the cases are going away. It's because of the fact that people aren't seeing these kids like they used to, whether it be a school teacher, whether it be maybe a doctor, just a general physical that they maybe had, or maybe clergy. Kids are not being watched like they were before. And really, I think that's important for us to continue to do that. So if somebody sees something, please reach out. If you need help with phone numbers or websites, the mayor's office, the sheriff's department, the DA's office. Domestic violence remains another issue that's ongoing in our community right now. And if you are in a situation whereby you are really, your life is at risk, I ask you to please call 911. That's for emergency calls. Call them. But also, if you feel you can get a plan together, if you can help yourself or your children, and we can stop these cycles of domestic violence, we can stop these cycles of child abuse, please go to the website, PlymouthDA.com. You can get information for Jane Doe. You can get information for other groups that are out there, health imperatives here in Brockton, that have help for people who are in those situations. Like I said, we're seeing our numbers go down, but that's not because they're going away. They're still here. They're just not as reported anymore. I don't know, Mr. Mayor, if you've heard from, if you've had an opportunity to talk to Chief Gomes and what's going on with the Brockton Police, maybe you can give us some information, if you have any, regarding the ongoings with the Brockton Police and Brockton Fire right now.
Yeah, so both Chief Manny Gomes from Brockton PD and Chief Mike Williams from Fire. I mean, right now, and you hit it on the head, DA, the whole focus is on the pandemic, right, the COVID, but crime doesn't stop, fires and emergencies don't stop. And just before I get into that, I want to thank the sheriff and the DA, because when I was elected, Joe gave me a tour of the facility down in Plymouth, and very professional people, very clean. It was a really wonderful experience. And Tim, in his capacity, invited me and Rick Savignano. I sat down, and at that point, I brought Manny Gomes with me as well. So we're all in this together. That's what it comes down to. And you know, I meet with both chiefs on a regular basis. I saw Chief Gomes today. We did a procession for late Mayor Carl Portaro that passed away. Russell Pica drove him by on his way to his final resting place, and came by City Hall. And I just went out, again, social distancing and wearing the masks, but I spoke to Chief Gomes. And, you know, in my humble opinion, we have the best and the bravest for Brockton PD and Fire. You know, they put their lives on the line. I don't have that in my fabric to do that, but thank God that they do. And they protect and serve. And, you know, they're dealing with a scary proposition, because they're going to houses that have positive COVID people there. Those are hot houses. And, you know, we work hand in hand with Board of Health to give that information to our frontline people. But right now, you know, we're working diligently with the state police. And I want to thank the DA. Again, I've said this for many years, as long as I was city councilor. The DA doesn't have to be in Brockton. They don't have to be in downtown in the core of the city. They could be anywhere in Plymouth County. But DA Cruz has made a commitment to do just that. And it makes a difference when we have the state police there on a regular basis, working hand in hand. And we have the feds as well. So crime doesn't stop. And unfortunately, that epidemic of opiate addiction, both legal and illegal drugs, is killing young and old, white and black, gay and straight. It doesn't matter. And together, and the key word is together, Brockton PD with the DAs and the sheriff. And you mentioned about Corey-friendly job fairs. Sheriff McDonald has been gracious. Jim Frazier of his office works here in my office and started under late Mayor Bill Carpenter. And Bill and Joe had a wonderful relationship, and it continues right now. And you know, what's good for Brockton is good for the county, and vice versa. So we are the only city in Plymouth County, but at the end of the day, it seems like a small town, right? I mean, you guys know that. We know everybody, and ultimately it's to make sure that the community that we serve is well served. And with both of you, I'll undoubtedly say that indeed we have a great DA and a great sheriff. So you know, I don't know about a great mayor. We'll see about that, but it depends on who you ask. But I'll tell you, during tough times, it's what tests us, and all of us are passing the test. But it's really the people we surround ourselves. I speak about when I went to the sheriff's office, wonderful team he has down there. I know many of the members on DA Cruz's team as well, and here in the mayor's office. So you surround yourself with people that have the same vision, same moral compass, and you get the job done. And right now it's just a difficult time, but we'll get through it.
Mayor, what do you see as the next steps happening here in the city when May 18th is right around the bend? Like you said, that is just a date like any other date for now. But assuming that there is going to be a step in the direction of reopening some of the businesses, things such as that, what do you see happening here in the city in that direction, in that vein?
Yeah, so Governor Baker had shared with us his proposition, you know, and then yesterday he made the declaration of 4 different phases. You know, in Brockton, because we're a dense population, we have a large population, a hot spot right now of this pandemic. We are going to take it slow. Without question, we're going to take it slow. And, you know, I have twice a week calls with the Chamber of Commerce and our friends down at DC from the Small Business Administration. I get it. People need to get back to work, but we need to have a safe community before we can do that. So we're going to have to dip our feet in the pool before we jump in. I know that my conversation today with Mayor Walsh and Mayor Arrigo from Revere just yesterday, we can have the 18th as a date, but as Governor Baker said, the 18th is the day that he's going to get his advisory board memorandum back from his advisors that are really testing it. And at the end of the day, what I think is Brockton will be a new normal. Here at City Hall, we're taking precautions, much like I'm sure you are, with plexiglass and social distancing. And there's going to be one way in City Hall, a different way out of City Hall. But I can tell you that the idea of a massive reopening on the 18th isn't going to be practical. We do know this is a certain that there will be a second surge. That's a fact. We hope to God it's going to be minimal. But if we don't take the precautions of what the healthcare professionals are telling us, this epidemic and pandemic that we're in right now will continue and languish. And we can't afford that in Brockton. With 205 deaths already, we really can't. I'm on 2 times a week with all the nursing homes, and they're sharing with me best practices. About 60% of our loss of life are from our local nursing homes, and it's the most vulnerable population, the seniors. And again, it's a confined area. We thought outside the box quickly with people facing homelessness at Father Bill's Mainspring, 54 North Main Street. We knew that on any given day, 130 people are there. It's a confined area. It's a recipe for a wildfire. So MEMA and DPH work with us to spread the wealth, and Perkins Park very well. And we put tents up there so we could spread the population. And it actually worked. Only 41 people came down with COVID, 2 loss of life. The rest have recovered. They went to the regional sites, the hotels in Lexington and Taunton. So to answer your question, DA, I don't know what the 18th is going to mean. I do know that Governor Baker is pushing hard for schools to open in September. I have a lot of reservations when you're talking about a student population just at Brockton High, over 4,000 kids. But the governor thinks it's going to be a different way of opening in terms of the old way of Brockton High was morning session, afternoon session. So I think everything's on the table. I do know that the teachers are working tirelessly here, not just in Brockton, throughout the county and the Commonwealth, doing the virtual. It's a difficult job, but the students and the teachers are working diligently. So as mayor, I'm proud of the fact that we have such a wonderful collaborative approach, but we're not through this yet, and we need to take it slow, but we'll get there.
Yeah, that was going to be my next question, was the teachers and how are they doing basically when all of a sudden all their kids are at home and they're with their parents and their loved ones, and the challenges that you have going online and how difficult it is, especially for maybe special needs kids and kids that need that extra attention. It has to be a real challenge for them as they get up every day and try to get their lessons done.
Yeah, again, I mean, Brockton's not a wealthy community, right? We're not Cohasset or Wellesley or Hopkinton, right? We're Brockton, Mass, and I'm glad we're Brockton, Mass. But we gave out 6,000 laptops, thanks to the superintendent of the schools, the school side and the city side worked in collaboration. 6,000 laptops were given out to 6,000 different families here in Brockton. We did it on the 10 sites because every day we have 10 sites to give out lunch and breakfast, so we piggybacked that. We also gave out 5,000 translated information last week. It was in English, it was in Cape Verdean Creole, Haitian Creole, and Spanish. Again, healthy practices, the wearing the mask, the 6 feet, all those things. So the teachers, I'm the son of a retired Brockton High teacher and a brother of a teacher that teaches at Brookfield. So my in-laws were both educators in Brockton as well. So I'm a little biased, but I'll tell you this. 2 of my kids go to Brockton Public Schools, 2nd grade and 5th grade. My oldest boy goes to a Catholic school, 7th grade. The teachers across the board, it doesn't matter if it's private or public, they are going beyond their normal scope. The principals are calling on a regular basis, all the homes in Brockton checking in, the teachers are. It's an emotional time. And I do want to just say right now that the seniors at the schools, again, they lost out on a lot of stuff that we did with proms and a normal graduation. So the school committee, and I chair it as mayor, we're working for a virtual type of graduation coming up in July. And again, Southeastern Regional across different county, but 65% of that population is from the city of Brockton. And again, we have Cardinal Spellman High School here and Heights Crossing, which is a charter school. So it is a new normal. I expect it to continue going into the fall, however we open up. But again, we have really dedicated people that care and making a difference for the young.
I'm glad to hear that. I think you're right. I mean, the kids have certainly missed out on a lot, from school sports to proms to the graduation and all the various things in their lives that we were fortunate enough to be able to do when we were young and growing up. And it's always going to be a void. So whatever we can do right now to help them fill that void, I think is important, especially with the unknown. If kids are either going out to the world to get a job or if they're going to go to college next year, it's still the unknown area right now. What are the kids going to do? So I appreciate the fact that you guys are doing the virtual graduation. I've heard that other towns in our county are doing similar things. And I know that everybody's reaching out together and talking about what they can possibly do to make it easy for the kids in the graduation situation with the mission. But I appreciate that. And Sheriff, what do you see happening as we proceed now, as we go down this direction? Your place has been solid. It has been rock solid and has been rock safe, if you ask me. And as a matter of fact, as we continue to deal with a lot of bail issues that are going on now that you briefly spoke about before, individuals who are being released, there were all sorts of lawsuits that were filed the last couple months ago that the Supreme Judicial Court heard. Some of the DAs and the sheriffs banded together with all 14 sheriffs. And I think at the end of the day, we're going to be doing what we said all along with individual cases. But unfortunately, what we see and what we've seen, not just in our state, but it's happened in New York at Rikers Island. We've had some individuals who have been ill and who have been released, and they go back out and they reoffend. And just the other night, just last night, an individual who was released from the house here in Plymouth, probably the end of March or so, was involved allegedly in Plymouth stealing a motor vehicle, driving through the town of Plymouth, ends up going down a boat ramp, and then attacks the police officers when they try to get him. That person had medical illnesses. There's no doubt about that. But my understanding is today at his arraignment, he once again tried to rely on the fact that he's susceptible to COVID-19. And I think the judge pretty much said to him at that point, agreed with us and said, you know what, you may be susceptible to COVID-19, but you're a danger to the community. And you're somebody who is putting other law-abiding citizens at risk. And we can't put ourselves in a position of releasing individuals who are going to first and foremost hurt other people who have done nothing wrong. So I think you were right when you talk about a lot of people trying to talk about how dangerous the jail is, and what I think petri dish is the phrase you always hear. I know from being down your jail, I know the mayor's been there also. It's just not the case, and that you've done a remarkable job. I think probably one of the best jobs, if not the best job in the state, with your house of correction down there and the people that are being released the normal way, or whether it be with our bail reviews, in which we're going to go to court and make sure that some people aren't released. And people should know that they're not just looking for low-level individuals to be released. We've been dealing with hearings, whether they be medical paroles or whether they be people who are currently doing time. I maybe have motions pending in Superior Court. People who are murderers, rapists, child molesters, armed career criminals, people with drug traffickers who are peddling this poison. And with all the work that all of our agencies have done, here in the city of Brockton, I think it's always been a challenge especially with the drug issues going on now. Now with Plymouth County Outreach and all 27 communities here in Plymouth County working together, sharing information, I think that makes a difference. I was wondering if you could expound on that, Sheriff.
Certainly, Tim, the anecdote that you referred to, the gentleman who drove the motor vehicle into the harbor, the waterfront here in Plymouth, was released on March 31st from here. And ironically, March 31st was the day that the SJC was hearing the case brought by the ACLU and the CPCS to engage in a wholesale release. And he was released, not under that decision, because he was released before it actually came down. But his motion was very clearly directed in that direction. They let him out, and this is what's happened. The good news is, hopefully he's not infected during his time on the outside, but I can assure you that he will receive appropriate medical care here. And hopefully, we'll get him into some programming in addition to just the medical things, and turn him into a productive citizen. That's really what we're hoping. But the most important thing for people to remember is that a lot of the horror stories that you're hearing, I know Cook County in Illinois was one. I know Rikers Island, you had mentioned, was another. In some places, it's a problem. It's an issue. And I think that needs to be dealt with there, but we need to be smart about this. And I think, I've heard you say this many times, that we need to be deliberate. We need to be mindful. We need to be smart about this. Some individuals probably are amenable to behaving themselves and can be safely released, but there are many that can't. And the good news is for those that we cannot release, I quite honestly think that they're safer here with us being monitored medically than they would be in the outside world. I know nobody wants to be in jail, that's for sure. But I think that the staff down here, as I said, has done a fantastic job keeping everybody safe. You know, certain things, the governor instituted the contact tracing. I know we're the first state in the union that's done that. That's something that, you know, we identified early on as well. Contact tracing for us within the correctional facility is much easier because virtually everything, everywhere, at all times inside the correctional facility is video surveilled. So we're able to review videos. If you have an individual that's been exposed, we'll know from watching the video who they spoke to, who they interacted with, how long they interacted, how close they came to each other, those types of things. So those are the things, you know, and it's very tedious to watch those videos, but our people have done that and have done a phenomenal job. And as a result, you know, we are very safe down here. And I think, you know, I want to direct it to people who have friends or loved ones that are here with us. I think they're safe. And I think it's important that people understand that. And I think to the activists out there, you know, think before you try and get people released, because a lot of folks think that they're doing a good thing by getting somebody out of jail, but without a plan, we may be doing more harm to those people than we realize. And I think it's very, very important. You know, there's one thing that I did want to mention. I would be remiss, a program, and Mayor, I will get information over to you about this if we haven't got it in your office. The Safety Assurance Program, are you familiar with that? It used to be called.
I'm not sure.
Yeah, the Safety Assurance Program, I know with a lot of us not being able to have the daily contact that we normally would have with friends or loved ones, the Safety Assurance Program, it's something that we've had down here since before I was the sheriff. I think Sheriff Foreman started it was called Are You Okay? Now it's Safety Assurance. The software has been upgraded, and over the years, I think the program is essentially the same, but has improved quite a bit. What it is people can sign up. There's no equipment to buy. There's no subscriptions. There's no code words, anything like that. You join with us, you sign up, you sign a form, and you are able to choose over the course of a day a call that's made from our communications center to an individual just to verify that everything is okay. It's an automated call, and normally people will answer the phone. They'll get the recording, and then they'll press the appropriate number to say that they're okay. If not, they can press a number to request help. Anything other than pressing that they're okay is going to involve the interaction and involvement of a live communications officer here at the department. And it's not like we're going to scramble the police and fire if someone doesn't pick up the phone. There is a hierarchy that we will engage in, and people can choose this themselves. So if you had a loved one, we called, and for some reason we couldn't get them, we would look to see what was, who is on their list. And as a loved one, they may have you listed first. We would call you first, and then get further direction from you. In times past, 99 times out of 100 or more, someone didn't answer the phone. It meant they were golfing, went away on vacation, forgot to tell us, something like that. But this program is free. You can call us here at the Sheriff's Department. You can sign up. As I said, no equipment, nothing. You choose the time for the call. And a lot of folks, their loved ones, their friends will have peace of mind knowing, geez, if I forget to call Uncle Al today, at least I know someone made that call. And, because it's very difficult for us to maintain those personal contacts right now. So if they call us, the 508-830-6200 number, that goes right to our communications center. They can tell the officer that they're interested in the safety assurance, and or they can even say the calling program. Just describe it if they can't remember the name, and we will get information to them and try and get them signed up. So totally free, something that we've done, as I said, for many, many more years than I've been sheriff, but it's a great program. And I think a lot of folks in the city might find that comforting, but also very, very useful. We've had over the years, we've had a lot of saves, and, saves of not just the people that answer those or don't answer the phone calls. But we had a situation where a senior was having a medical issue and had called, we had gotten involved, and their daughter, who lived some great distance away, who was racing down to get to her mom, we were able to assure her that no, we had medical personnel, EMTs, paramedics at the scene. The fire was there. So she could, instead of racing to mom's house, could drive in a little more safe manner and go right to the hospital where we knew she was going. That story had a happy ending. We have a lot of those stories, and prevented a lot of tragedy. Free program. Please let everybody know. Join it if you think, or let other people know that may have a need for that. So I wanted to get that out there before I forgot.
I'm glad you did that, Joe, because I know every time we do our senior luncheons every year, part of the talk always is, and it used to be a version of, it was called "Are You Okay?" before, and things such as that.
Yeah.
Everyone talks about that program, and it's so great for seniors, and like you said, it's free, and it's at your convenience, and it's something that I think it might give your loved ones a little bit of a peace of mind, that that they know that somebody else is watching, and your organization is good enough to do that, and I know that the people that I know are glad that you have it, and I think that it's made a difference in some of their lives. So I appreciate that too. Well, as we get near the end of our forum here, I was wondering, I'll give you both a couple minutes to wrap it up as best as you can, and we can let people know that as we continue to do our jobs as best as we can. But Mayor, would you like to?
Yeah, first of all, I want to thank both of you really for what you do to better Brockton on a daily basis. I mean, the sheriff has been great in terms of having people come actually and do some repairs here at City Hall. And as I mentioned, Jim Frazier's here in the office to help people that have gotten out, and it really is a win-win. And of course, I can look out my window right now and see Tim's office, which is a wonderful feeling as well. So we're dealing with the COVID-19 right now in the city of Brockton, and that's the paramount issue right now. But the other thing that we cannot neglect is the federal census. The federal census comes every 10 years, and I'm going to be very blunt about it. 48% response so far, less than 50% in the city of Brockton. Not good, not going to help us. If we miss the boat, we got to wait another 10 years. We need to get the numbers right. We all know we're over 100,000. We're probably 115,000, but on the books, we're under 100,000. So we're going to be losing a lot of federal money that can help Brockton, and we need that. So I will say the Secretary of State, Bill Galvin, called me the other day. We got a $50,000 grant from the Commonwealth to try to maximize our benefits. So anybody watching this, you can do it 3 different ways right now. You can do the old-fashioned mail-in. You can do it online. I did it not too long ago. It took me less than 5 minutes, and I have 5 people in my family. Or you could do a call-in. And again, I'm just asking anybody, if you live in the city of Brockton, you're a Brockton resident, please, please, please take the 5 minutes to 10 minutes and do the federal census. It's really going to pay dividends for the city, our schools, and our community as a whole. So thank you.
Thanks, Mayor. And thank you for everything that you do. And I agree that doing the census is really important. We all deal with trying to get monies from everywhere we can, especially the under-resourced communities like Brockton. And we need to make sure that we get an accurate count and make sure that people do that. That small bit of time can make a really big difference for the community. So I think you're absolutely right. Sheriff McDonald, would you like to take a couple minutes?
Certainly, Tim, thank you. I think the most important thing that I want people to know is that contrary to reports that they may see of disasters happening in other places, references, and I see it in the media, not necessarily locally, but, coming out of Boston about how really everybody in the correctional facility is in peril based upon this. And I think that the evidence in our county correctional facilities here, really statewide, has been very much to the contrary. There have been certain hotspots. I know that Middlesex County had a few, Essex County had a few, but they're doing what we've had only. I think Essex County last week had their first fatality, but again, that was a person who had a lot of underlying health conditions, and our populations are very, very safe, and especially so here in Plymouth County. That's been really great. I want to say to Mayor Sullivan, I really think you've done an excellent job over there in the city under some very, very, very difficult circumstances. I was so pleased. You know, I knew you before you were mayor, and thought very highly and respected you. But you know, you really went out of your way to come over here to see us here at the correctional facility, to see for yourself what the conditions are here, the programs that we have. I know that you're dedicated to continuing those job fairs that we've had. I really appreciate that. You know, I think you had mentioned something about you know, the heroics you didn't feel were part of your fabric, but what I think is part of your fabric, and it's important for people to know, is leadership. And leadership, I just jotted down something that I had heard a while back. It's not a position or a title. Yes, you are the mayor, and we're lucky for that, but it's action and it's example. And I think the decisions that you're making now are saving lives. And I think, you know, they're not easy decisions, and that's leadership. And I thank you for that.
Thank you, Sheriff.
You and your staff, you guys have done such a great job over there, making sure that everything that we've done here in the criminal justice system with all those bail reviews, that everything was done in a mindful, careful way. And I think that really we have maintained a remarkable record of public safety continuing through this crisis. And, you know, we're committed to doing that. I'm glad you're on our team, and I'm glad to be, you know, look and see you guys. And I look forward to doing more of these. Hopefully, you know, we can get some medical people to come on and talk about, you know, some of the specifics that people may have questions about. So really thank you for including me in this. And my message is this: the people down here, the men and women that work here, are doing an excellent job. They're working hard, and everybody is safe. Thank God.
Well, Sheriff, thanks so much for everything that you do. I appreciate, we work very close together. And I've seen the ability to firsthand watch what you do and the difference that it makes down there, and it makes for the people here in the county of Plymouth. So, you know, I appreciate that. And from the DA's office, once again, you know, we are in different times, and people continue to work hard, work remotely, social distance. We are a state agency. We will do the mandates as they've set forth as they continue on here. We anticipate our offices, the courts opening again June 1. I've been told jury trial July 1, hopefully. But like we all said, we're not sure. Those are the rough dates. I'm hopeful that we can get back on track sooner rather than later. But I'm also grateful for the fact that we do have this, as the sheriff said, leaders like him, leaders like the mayor, people in our community who continue to understand that slow and steady wins the race, that we can't just jump into something, but we also have to understand the situation where we currently are, and making sure that we continue to do what we can do. So I thank you guys so much for coming on tonight. This was our first COVID-19 update that we've done. I'm sure that we will do more. And I will certainly be reaching out once again to the sheriff and the mayor and other people who might bring more information to all of us, so we can understand how do we continue to navigate the situation that we're at. So I want to thank Mayor Sullivan. I want to thank Sheriff McDonald. And I want to thank everybody for tuning in tonight and taking some time out of their lives to listen what it is exactly that what we have been doing. So I hope everybody can remain healthy, can remain safe. That's the important thing. We will get through this. It'll be over before you know it. Let's persevere. So everybody, please have a good night, and thank you guys for coming on board tonight.
Thank you.
Thank you.
Thank you.